option. So now I'm excited to introduce to you today's ataxia expert, who is Dr. Susan Perlman. Dr. Perlman is currently a clinical professor of neurology and director of the Ataxia Center at the UCLA Medical Center in Los Angeles, California. She has been the head of the Ataxia Center at UCLA since 1983. She has worked in ataxia diagnosis for over 30 years, and Dr. Perlman serves on NAF's Medical Research Advisory Board, NAF's Board of Directors, and is NAF's Medical Director. Welcome, Dr. Perlman. We are so grateful you are here to answer our questions today.
Okay, I think I successfully unmuted myself, and I'm looking forward to speaking with all of you. I see some familiar faces and many new faces, people that I haven't met yet. I'm hoping that the question and answers that pre-submitted questions, as well as some of the questions you'll be posing today, will be in a format as if you were in my office here and we were discussing these things in person. Many of the questions that have been submitted are things that we discuss from visit to visit. So even if we don't get to some of them today, I think the next expert who will be joining us for, I guess, a session next month is a dear colleague who, again, is very skilled clinician, and we can carry on this conversation amongst us. So I thought we would start with 2 or 3 of the pre-submitted questions, and then Lori and John are going to be monitoring the chat after they block the trolls, hopefully, so that we can take some of the live questions, and then we'll go back to some of the pre-submitted questions. The first pre-submitted question, very appropriate for California. What does the latest research show for the benefits of CBD oil and/or hemp for ataxia symptoms? This individual has seen positive anecdotal evidence, probably in chat rooms or other settings. And I quickly dove into the literature this morning and found that most of the research about CBD and related substances, cannabidiol receptors in the brain, relates to epilepsy and often pediatric seizure disorders. There was a mouse study published in an ataxic mouse where the symptoms of ataxia when the mouse was administered CBD actually got worse. And there's an enormous amount of literature about the usefulness of CBD-related compounds for depression, anxiety, pain relief, and sleep. And any ataxic patient who has depression, anxiety, pain, or sleep problems, if they used CBD under supervision by their physician, could benefit from that, ideally without making their ataxia worse. But to actually treat ataxia, there's no resources that I've been able to find, nothing in the research literature that says it helps the balance problem itself. The next question is from a SCA3 individual and wanted to know if there was any medication to address spasms. Now, spasms in SCA3 can either relate to the upper motor neurons, which can cause tightening and painful spasms of muscles, or could relate to the peripheral nerves as they connect to the muscles. And if that connection is unstable, the muscles can cramp or spasm. So that there are many muscle cramp medications over the counter and by prescription that can be used by individuals who suffer from this. For the upper motor neuron mediated spasms or spasticity, Baclofen and tizanidine by prescription have been in use for many years. And there's a follow-on question from another individual asking if Baclofen can adversely affect balance in a person with ataxia, and the answer to that is yes. If you read the fine print on side effects for Baclofen, one of the side effects is ataxia. It's also weakness. So if you are using a drug like Baclofen for muscle spasms or spasticity, downside if you get too much could be your ataxia will be worse, or you'll be weak in the muscles, which will also affect your balance and movement. And then the third question from an individual with spinocerebellar ataxia type 6 is regarding vision. As described, not really double vision, although double vision can occur in almost any of the ataxias, but it sounds like it could be nystagmus or jumpiness in eye movements that seems to cause dizziness when the individual puts their head down. She does have, or he does have, prisms in glasses, which can help with double vision. There are eye exercises that have been used by optometric professionals who specialize in this that can help stabilize eye movement in ataxia. If a person has double vision that is the same in every direction that they look, surgery can help to reduce that and reduce the amount of prism glass correction they will need. So a skilled ophthalmologist or optometrist can often intervene in the vision problems caused by ataxia. There is one medication which has been used as a compounded medication over the years and is also available as a generic prescription medication off-label, which has a track record for being helpful for eye jumpiness, nystagmus, eye coordination, and the dizziness associated with them. And that is Ampera, which is the name brand, or dalfampridine, which is the generic name. The compounded formulation is known as 4-aminopyridine. So any of these interventions could be helpful to stabilize the eye-related complaints that can be troublesome in ataxia. But any drug that we talk about today, any treatment that we mention, definitely discuss with your local neurologist or primary care doctor. Not being able to sit with you face to face and go through your exam and look at the symptoms that you're having could mean that something I'm discussing may not apply to you at all. So it's always important to work with your local doctor, even if you're the only ataxia patient your local doctor has ever seen. Why don't we go to some of the submitted questions from the chat, Lori?
Sure. So Dr. Perlman, there was a question, are a lot of people falling or having balance issues with ataxia, and does physical rehabilitation help?
Falling is often the first symptom somebody will have, an unexplained fall, that may let them know that there is a problem with balance, whether it turns out to be a genetic problem or a non-genetic problem or something that happened as a result of a head injury. It's the first fall that makes people concerned. Maybe there's something wrong and may often lead to a visit to their local doctor or a referral to a neurologist. The best way to control falling is to not walk, obviously. However, that's not a practical thing for people. So if you're going to maintain mobility and avoid falling, assistive devices can be helpful. Canes for some people, walking sticks, walkers, or rollators can be of use. Holding onto somebody's arm if you're going somewhere with another person. Using a wheelie backpack in school, for instance, can act like an extra foot on the floor. So there are strategies that involve equipment, assistance from other people, recognizing the situations that you may be in danger of falling. If it's on stairs, always use a handrail. Physical therapy exercise, working on core stability and strength in the core, the hips, the legs, can also help with stability and the ability to recover from a feeling of imbalance before you fall. On the other side of the fence, though, if you do fall and you have times where you need to be up moving around and you're at risk to fall, be sure that you've got some way to contact someone by one of the wearable devices or a cell phone that you'll always have with you in case you do fall and have an injury or have trouble getting up. So assess the situation, find out why you're falling, see if that can be treated directly, get physical therapy involved, make sure you have backup. And if the only way to stay on your feet is going to be to use an assistive device, don't be shy. Lori, another
Very
question.
good. So how prevalent is fatigue and ataxia with those with diagnosed types of ataxia and those with undiagnosed types of ataxia?
There are probably 3 or 4 ways fatigue can become part of the ataxia problem. One, which I think still needs more research to better define, is that within the brain, there are activating pathways. You know, they work with the sleep cycle. When we're awake, they're activated. When we sleep, they're not activated. And there are other communicating brain pathways that involve the cerebellum, the balance center, that if they are a little off, fatigue, central fatigue or brain fatigue could result from those. And this has been in exploration by the group at Mass General under Dr. Jeremy Schmaman, who is looking at the effect of the cerebellum and its connecting pathways on memory and thinking, speed of thinking, emotional regulation, and fatigue is going to be part of those pathways. The second source of fatigue could just be muscular deconditioning. You have a balance problem, you're not as mobile, you're walking less, you may or may not be exercising appropriately. And if we're deconditioned, we fatigue more easily, we feel tired. If you have a peripheral neuropathy as part of your ataxic syndrome, and many of the spinocerebellar ataxias do affect peripheral nerves as well as the cerebellum, the decreased stimulation of the muscles can cause an otherwise normal muscle to fatigue more easily because it's not getting its nerve signaling. And then if there is deterioration of brain cells, you know, there's genetic damage going on, brain cells are deteriorating and potentially dying, that can set up some low-grade inflammation. You know, whenever there's, you know, a weakened or dying, you know, piece of tissue anywhere in the body, the inflammatory system mobilizes to try to take care of it. The inflammatory system, even at that low level in the brain, puts out chemicals which can increase fatigue and lower your threshold for pain, so that it is not uncommon. And I would say probably 50% of the patients I see with all types of ataxia have some amount of fatigue and may have some pain sensitivity as well, coming from, you know, the central nerve pathways, peripheral nerve and muscle pathways, injuries, et cetera. So I think 2 of the things that we can treat that can improve quality of life is fatigue with medication or proper exercise, and energy conservation. There was a question here about an electric wheelchair. Certainly an electric wheelchair is a good way to conserve energy if it's appropriate for your lifestyle. And certainly pain should not go untreated. Anybody who's having any type of pain as part of their ataxic syndrome, treat the pain and you'll immediately improve quality of life. Lori, one more question from the chat, and then we'll go back to some of the pre-submitted questions.
Sounds good. So do you have any other recommendations for other supplements that could help slow progression or make symptoms that you haven't already talked about better?
Supplements, vitamins, special diets aimed at protecting nerves against gene stress or unknown stressors in the non-genetic ataxias. Discussions have been going on for a generation or 2 about the best things you can do that don't require a prescription medication or an experimental treatment. And I know that the NAF has, I believe, online at least one webinar that discusses diet. and the different dietary approaches, the Wall's diet, the ketogenic diet, diets that can improve fatigue, and there's a number of approaches, all of which are under experimental approaches by researchers. So if you go online to Google or to one of the medical literature sites and type in vitamins ataxia, you will get a lot of research papers and presentations about what's going on. I don't think any supplements have been shown to slow progression of ataxia. There has been work done in the ataxias and other genetic disorders with high doses of CoQ10, high doses of creatine as two examples of supplements that can improve energy production, might protect brain cells or muscle cells or heart muscle cells, or the brain in general from aging. But none of those trials showed statistically significant benefits. I think what proper nutrition that's appropriate for you, supplements chosen carefully, and tried for a reasonable period of time may be able to help with. They can help with fatigue. I think there's enough evidence to say that proper nutrition, appropriate nutrition, and appropriately chosen supplements can be helpful. I think the popular supplements are ones that are written up in the anti-aging literature that are supposed to slow the aging process, which we know is part of progression in the adult ataxias. The genetic factors or environmental factors that are targeting the balance center are not helped by the fact that our brain is aging from the age of 30 onwards. So there they discuss vitamin E, coenzyme Q10, omega fish oil, alpha lipoic acid is another one that has some safety behind it and also some literature that supports it. But any supplement that you want to try, be sure that your physician knows about it. Some supplements can interact with prescription drugs that you may be on for other conditions. So let me go back to this terrific list of pre-submitted questions. There's several questions about stem cells that, we hear a lot about them. They're in the news. They've been tried for various neurologic and medical disorders, for, a generation or more. So stem cells, as we're looking at them for ataxia, seem to be being explored for three different reasons or three different ways they could make an impact. We know that infusions of stem cells, even intravenous infusions, potentially spinal tap given infusions of stem cells, stimulate growth factors. Stem cells themselves contain growth factors. They're baby cells, as it were, that have active growth factors that are ultimately helping them develop into muscle cells or heart muscle cells or brain cells, so that adding growth factors to the nervous system or the general circulation, which goes to the brain, is felt to stimulate damaged nerve cells to grow back, stimulate your own stem cells that you have in your brain or in various parts of your body to be active and grow in to replace nerve cells that might be damaged. This is probably the most popular theory about how stem cells could be helpful. And there's stem cell research going on at the Mayo Clinic in non-genetic ataxia, and also with several groups outside the US, one in South Korea and one in Taiwan, looking at non-genetic and genetic ataxias with this approach in mind. We also know that there have been trials using stem cells directly to replace missing nerve cells in the part of the brain that controls Parkinson's. For instance, there have been stem cells utilized to replace cartilage in joints when a joint has worn down. I think replacement, hoping those stem cells are going to grow in and replace something, is not as clearly confirmed. More likely, their influence is going to be on the other tissues that are already there in your body, which can be benefited by the growth factors. So if you're looking at stem cell treatment, there are plenty of companies out there that are advertising stem cells. I think the ones that are most common and may potentially have a benefit are the ones that are using stem cells and stem cell related components for joint symptoms, replacing cartilage, dealing with joint related issues. Most of the companies that advertise online that are located in Mexico or in Central America or have offices in the United States and then take you out of the country for treatment, charging you a fortune, probably do not have the research backing to say that they could be helpful for ataxia or any brain disease. There will be controlled clinical trials sponsored by real researchers doing approved and carefully supervised research and not charging you $30,000 for such a treatment. And these are the ones we have to keep our eye on. It's an important area of research, but it's not one that you should mortgage the house to take advantage of. And there was a similar question about PONS, PONS, the portable neuromodulation stimulator, which has been approved in Canada. It's a stimulating device that you put on your tongue, and it ideally stimulates the nerves to improve central nerve connectivity. So that by stimulating the tongue, and you think, acupuncture stimulates the ear or stimulates the foot and theoretically has an impact on the brain. So there's been a history over a long time of peripheral stimulation affecting the brain. And the theory here is that this PONS device placed on the tongue will help the brain reorganize, reconnect, recover from damage of various types. It's been used in traumatic brain injury. Like I say, it's approved in Canada, has not been approved by the FDA. The problem is that it has to be done by a licensed practitioner. The published cost for such treatment, protocols, $30,000. And it's always paired with physical therapy. So is there any research demonstrating that the stimulation alone, not connected with physical therapy, can be helpful? And I think further research is needed, certainly in, transcutaneous nerve stimulation, transcranial magnetic stimulation, transcranial direct current stimulation, acupuncture, and related technologies. We know that there's an impact, but if exploring it for yourself, like I said, involves mortgaging the house, probably not something you should jump into until we have, number one, more research behind it, and number two, approved therapies that could be paid for by your health insurance. Then a third question was, why are there still no medications or therapy that fight the symptoms that you have with ataxia, whether it's balance, whether it's tremors, whether it's some of the brain fatigue or problems with memory and thinking that come from the cerebellar cognitive affective syndrome. The National Ataxia Foundation has on its website a nice publication and list of drugs that can be used for the symptomatic management of basically any symptom an ataxic patient might suffer from, whether it's tremor, whether it's balance issues or dizziness, whether it's the eye-related changes we've already discussed, whether it's pain or spasms or sleep or mood issues. It's a wonderful resource for you and for your local physician. So, Lori, other questions from the chat?
Yes, Dr. Perlman, we do have some more questions from the chat. How many types of ataxia are there?
If we look at the known genetic ataxias that are inherited dominantly, that occur in every generation, I think the numbering system is up to 48, with some ataxias just affecting a single family or a small number of families. And the progress we've made in identifying and enlarging that list comes through all the genetic researchers that are working with the National Ataxia Foundation on finding new ataxia genes. There are probably, for the dominantly inherited ataxias, if you screened for all of the known 48 types, you would probably only identify maybe a little over half. There are still many familial ataxias that we just don't have a gene for yet. Similarly, for the recessively inherited ataxias, if you looked at a list of the number of genetic ataxias that require two bad genes, one from a mom and one from a dad, there's again probably over 100 that have been identified. And we know the genetic factor, we know what stress it's putting on metabolism or other functions, and may actually lead to a more specific treatment. But including all the genetic ataxias, dominant, recessive, mitochondrial, X-linked, we can still identify at most 60%, which means we have 40% of the ataxic population that there's a gene, we just haven't found it yet. It truly is non-genetic. So if we look at the different types of ataxia, I believe, that we're probably looking at 500 ultimately, and probably more, 500 different causes. So that symptomatic management is going to be important for a long time. But as we succeed in identifying each of the causes for each of these unique forms of ataxia, more specific therapies and potentially therapies that can modify the progression of the disease will also become available. So we have to keep looking at that pipeline and supporting all the researchers who are doing that work, and the National Ataxia Foundation, Friedreich's Ataxia Research Alliance, and the other research groups that know that, over the last 50 years, since we've been looking at the cerebellar disorders, we're now on, the home stretch, we hope, towards disease-modifying therapies. Lori, another question from the chat.
All right, so we have a couple on COVID-19, Dr. Perlman. First, does COVID-19 affect ataxia? And two, is it safe to get the vaccine?
I have a number of friends in my community who periodically will message me, should I get the COVID vaccine? My husband says no, I think I should, or vice versa. And I kind of ghost those calls because I don't want to come between, a marital couple that are having an argument about the vaccine. And there is still a lot we don't know about the vaccine. We have 3 approved vaccines. One, I think has been put on pause because of some potential blood clotting side effects. But, there's a general evidence, and I think it's showing now in the population, that the vaccines can reduce the occurrence of COVID infection, or at least the occurrence of severe COVID infection. Because it's not a live vaccine, which many of the other vaccines that we have are, then we don't have to worry about people who have a low immune system receiving a live vaccine that could then give them the disease. And this was the problem with the polio vaccine at one point in its development over the last number of years. So the vaccines are based on technology that can stimulate your immune system to make antibodies that will protect you against getting a severe case of COVID, potentially protect you from getting COVID at all, with relatively minor side effects. Now, as more people are vaccinated, we do recognize, some of my ataxia patients have been vaccinated and shared with me, yeah, my arm was sore for a day, but I was exhausted for a week. I couldn't get out of bed for 2 weeks because of fatigue, I think is the most common side effect ataxians have described. But there is a growing list of neurologic complications from the disease itself. Knowing that, you know, the most visible and earliest complication was lung related, because of the intense inflammatory reaction of this virus that is, you know, it's an inhaled virus, and, you know, goes to the lungs first. But we know that there's loss of sense of taste and smell, which are nerve related functions in this area. And, you know, as people are recovering from COVID infection, more and more potential neurologic complications are being described. Nothing like the Guillain-Barré that accompanied the flu vaccine a number of years ago. But, you know, I think, you know, we're being cautious, you know, we're monitoring everybody, but the majority of people are protected and don't have any lingering complications from the vaccine. And now that the incidence of the disease is going down, you know, I think, you know, concerns about, you know, lingering complications from the disease will hopefully also be going down. Certainly in North America, you know, we've been fortunate in that regard. But this is a story that every week, every day, there's something new that we're learning about it. So I think we have to be, you know, informed consumers. You know, I had to get the COVID vaccine to go to work. It was required. Other people have had the same restrictions. They have to get vaccinated or their work life and travel life is going to be severely compromised. If these are not going to be concerns for you, I think it's okay to decide not to be vaccinated as long as you protect yourself or at-risk people around you, frail elderly, from exposure to the virus. One more question, Lori.
All right. Thank you, Dr. Perlman. So right now, are there any treatments for the symptoms of cerebellar ataxia? And what is your best guess about when potential therapies will be available to the general public? And any updates on the current Cerebellar, I can't pronounce it, clinical trial that's going on?
Well, we know that there's a lot of medications for symptoms, a lot of non-medications for symptoms as well. So nobody should be troubled by symptoms that compromise their lifestyle in a way that we can improve. Modifying the disease, however, is something else. And there was a question that somebody put in there in a clinical trial of, they didn't say what kind of ataxia. And there are several that are running now. There's one running for genetic ataxias, and there's one running for non-genetic ataxia. And there will be more in the pipeline. And I think, you know, we have the pipeline. I don't know if it's been posted on the NAF website, but, you know, the pipeline that I presented at the meeting will be growing. And we're moving from drugs that are just symptomatic drugs into things that could modify the course of the disease, whether it's an inflammatory reaction that is complicating an illness, as with multiple system atrophy. You know, the current drug that's in trial is reducing brain inflammation and helping to protect those nerves that are under assault in that form of non-genetic ataxia. On the other side, we have the troriluzole trial, which is a drug that has symptomatic benefit, and hopefully the study will show that. May also be neuroprotective, you know, protecting the nerve cells in the balance center from in this case, the gene stress of these genetic disorders. But that drug could have impact in non-genetic ataxia as well. So I think we've got the beginnings of a good foundation for designing trials in patients and communities with patients with ataxia, in what to monitor in those trials, what we can expect to see, and what we may not be able to show in a 2-year trial, for instance. Some forms of ataxia progress very slowly. And this individual who is in a trial and says they don't feel they improve, even if they stabilized over a year or 2 years, that could be a positive impact of that treatment. So even if it doesn't improve or bring back nerve cell performance, if it can prevent future damage, that's an important outcome measure that we will be looking at. The drugs that are coming up for human trials in the next few months, and certainly in the next year, many of them are going to be focused on genetic ataxia. Many of the common genetic ataxias involve the production of an abnormal protein, which builds up in the nerves and is toxic for the nerves and causes nerve cell death, resulting in ataxia. So some of the drugs in the pipeline from different companies focusing on different genetic ataxias aimed at blocking the production of that protein or making it easier for nerve cells to get rid of that protein before it builds up. And there are active research and development groups. There are plans for phase 1 studies and phase 2 studies looking for proper dosing, potential side effects, and the best things to measure to show benefit. So even though we currently have a very small number of trials running for the various forms of ataxia, I think that number is going to double in the next year. I think there will be more beginning trials that everybody, should look to. Is this something I could participate in? The trials are not going to show benefit. They're not going to prove that we can develop a drug that could potentially almost be a cure for these forms of ataxias if you don't step up and, participate. If it's appropriate for you, if the drug is appropriate for you, if, you meet criteria, make that little sacrifice of time and travel now that we're opening up, research sites again, and get involved. Companies are very interested in developing disease-modifying drugs, either for genetic ataxias, blocking the impact of the gene, non-genetic ataxias, preserving the nerve cells and allowing recovery of nerve cells. Because everything that they develop in the rare ataxia disorders could be applied to the more common Parkinson's disease, Alzheimer's disease. So we are really, at the forefront of development of drugs that are going to be the next generation, being able to treat the brain, recover the brain, and not just for rare ataxias, but for other disorders as well. Let me go back to some of the pre-submitted questions. And I think we're doing okay on time here. Somebody commented that they're using a rollator, a walker, and that an ankle started to bother them. And that they were, going to try to stay off their feet for a day or so and use their scooter. And, they said maybe it sounds silly. Potentially they're going to tell their local doctor. Potentially they'll just, put some ice or heat on it and try to ignore it. But I think it's important, if you're using, number one, a piece of equipment and you begin to notice an ache or a pain or something that doesn't feel right. Maybe it's the wrong equipment. Maybe you're not using it properly. Maybe, having a rollator is letting you stay on your feet longer than you should be on your feet. So, something small, it may start out small. If you ignore it, could end up with, a chronically painful ankle that is going to alter the way you walk. On the other hand, with ataxia, your gait, your walking pattern is altered. It's different. And it does put stress on the joints. It puts stress on the feet, on the ankles, on the knees, on the hips, on the low back, because you are walking differently than the way it was programmed in when you were born and learning to walk in the first place. This is where your orthopedic surgeon consultant, rheumatologist consultant, or an orthotist who specializes in equipment or shoe inserts or bracing can provide help that will prevent the buildup of a secondary problem that you just don't need. Then there was a question about traumatic cerebellar ataxia. There were actually 2 or 3 questions about somebody having a head injury, closed head injury, or even a non-contact, just a whiplash kind of injury, developing balance problems afterwards. Certainly, if you hit your head in an auto accident or a fall, you could have a concussion. Concussions are notorious for lingering pain, lingering dizziness, changes in vision, ringing in the ears. So, a concussion can cause symptoms of ataxia. If you already have ataxia, it can amplify those symptoms. So, with concussions, over time, the irritation from that closed head injury, should improve. I've seen people who, finally after a year, the residua from their head injury of the year before has finally gotten back to a baseline. So sometimes you just have to have tincture of time and focus more on positive things you can do to protect yourself from future falls and to try to rebuild, your strength and your balance and your performance. There was a question about how, a whiplash, where your head goes forward and then goes backwards without any contact with a windshield or anything, maybe a sore neck, how could that cause ataxia if you didn't actually hit your head on something hard and get a concussion? It's called, coup contra coup, go forward, go backwards, and the brain moves within the skull. The brain floats in spinal fluid. It has connections to the inner lining of the skull with blood vessels and membranes that cushion and protect the brain from just this type of injury. However, the cerebellum sits against the bone at the bottom of your skull, so that what seems to be a no contact kind of whiplash injury, you could be, as it were, bashing the cerebellum against the back of the skull. And they have shown that people with severe injuries of that type can have microscopic bleeding or small damage to the nerves in the cerebellum. If you don't have already an underlying ataxia problem, you might be left with some mild changes. It might recover completely over a period of a few years, but it could certainly add ataxia to an underlying ataxic syndrome. And it would be treated the same way you would treat a genetic ataxia, for instance, with proper therapy, with appropriate symptomatic medication. So it's always important as an ataxian, if you have a head injury or a whiplash, expect that your symptoms might be amplified. And be sure to inform your local doctors or physical therapists. I had a head injury, I hit my head. This could be why I'm feeling worse, I'm not doing as well. And then they can provide some extra eyes to monitor that. Then I think there was one other question on the pre-submitted ones that was, again, addressing a different area. Let's see. Choking. Best way to prevent choking on food and drink, or saliva for that matter. Speech therapists also deal with swallowing problems. If you have incoordination of speech, you could also have incoordination of swallowing. In the average ataxian, it's going to be problems with crumbly foods, dry foods, mixed textures, soup with pieces, watermelon that has a lot of water in it, and also, fibrous pieces. So the common sense things that a speech therapist or swallowing therapist would tell you are the same things your mom would tell you. Don't talk and eat at the same time. Eat slowly, take small bites, alternate solid foods with liquids to clear your throat before you take your next bite of food. If it's an issue with liquids, which some people will notice, they're okay with solid food, but every time they have a sip of water, they'll cough. Sometimes a straw will help. And there are symptomatic medications that can help coordination of the muscles in the throat that are involved in speech and swallowing, which are listed on that medication list on the National Ataxia Foundation website. One thing we've noticed in progressive neurologic disorders of all types that involve problems with movement coordination and balance is that in the middle stages of such a disorder, you've got it, you've had it for a few years, you have balance issues, you're doing your best to compensate for them without giving up too much of your daily activities. The most common cause of death in those middle stages is falls with head injuries or choking. And so these are two things that we need to be aware of. Some people with ataxia may never develop significant swallowing problems, but it's something we always ask about. Lori, other questions from the chat?
Yes, just to piggyback off the swallowing questions, does swallowing symptoms with folks with ataxia, do those usually progress, or does those exercises that you mentioned, does that help with progression?
With ataxia in general, and whether it's exercises for speech and swallowing muscles, exercises for upper body, exercises for standing and walking, they won't prevent progression if you have an ataxia that is going to progress, like genetic ataxia, for instance. If you have an acquired ataxia, you had, cerebral palsy, which included ataxia, you've had it your whole life. Theoretically, interventions like physical therapy and exercise can improve performance and put you on a plateau that you can maintain for years until aging kicks in. But with progressive ataxias, exercise, physical therapy for speech and swallowing, for upright stability can improve performance, but you'll still be facing that slow future decline. What it will prevent is the decline based on deconditioning. If you have a balance problem and you just give up on walking, your muscles will become deconditioned. Your balance will then become worse on top of whatever the ataxia is doing. So I think we all recognize that good physical conditioning, is symptomatically beneficial and, can put you more in control of the symptoms of your ataxia. There's some evidence from some mouse work done with the ataxia type 1 mouse that exercising mice have more nerve growth factors produced, which can actually protect the nerves and might slow progression of the disease on a very disease modifying basis. Now, there's only been shown in the mice. I'm sure there are research groups working on that for all of the genetic and non-genetic ataxias. So there may well be a disease modifying effect of exercise as well. And not everybody develops severe swallowing problems. The nerves and muscles that supply speech and swallowing are shorter. They may be more resistant to the stressors that are affecting the longer nerves. But it's important to monitor and to ask. Other questions from the chat?
Absolutely. So going back to our discussion on clinical trials, there are some folks that want to get involved. And what's the best way to get involved with clinical trials? Is a referral needed?
You can self-refer for any clinical trial that you might see posted on the National Ataxia Foundation website, the Friedreich's Ataxia Research Alliance website, or the clinicaltrials.gov website, which you type in clinicaltrials.gov, the website comes up, you type in your diagnosis, you type in, treatment, and it'll give you a list of active clinical trials that occur, in the US, in your state, in your city, and they'll have a contact number that you can then call and say, I have such and such a diagnosis, you have a trial for my diagnosis, I'd like to meet with you or talk with you or have a video visit with you to see if I'm a good candidate. So self-referrals, absolutely. Your doctor can help you find clinical trials. And if you're part of the registry, the ataxia registry through the National Ataxia Foundation or the Friedreich's Ataxia Research Alliance, if you're participating in natural history studies, which are usually part of an annual visit to an ataxia specialist, they can enroll you, as it were, in a natural history study where your data will be given a code number, kept in a central computer for North America or internationally, so that as part of the registry or a natural history study, you can actually receive notices about clinical trials that might be appropriate for you. So even if, all you can manage is a once-a-year visit to a research site, as part of the natural history study and then the registries themselves, you will always be able to be notified about a trial that's coming up. More trials are now being designed that can be done remotely. We're developing ways to measure ataxia by wearable devices, by testing that can be done on a video visit, so that traveling, every 2 months to a research site, which was a big roadblock for participation in clinical trials previously, is being relieved now, in part because of COVID. A lot of visits, that we would have in person were relegated to telemedicine visits, which really forced us to become better at doing an exam, as it were, by telemedicine. So I think there will be more opportunities, and you can initiate those yourself. Other questions from the chat?
Absolutely. Can and how does temperature affect ataxia?
Well, we all know that temperature sensitivity is a big factor in multiple sclerosis. And that's because multiple sclerosis has an inflammatory effect that wears away at the insulating fibers, the insulating components of the nerves. When the nerves or the body becomes overheated, those partially de-insulated nerve fibers don't conduct as well. So in MS, getting overheated is a no-no. It has a direct negative impact on nerve performance. So staying cool can help nerves perform better. In the ataxic disorders that may include demyelination, where nerve fibers may be involved, but the insulating coverings of the nerve fibers may also be involved, getting overheated could have a negative effect. So I think it's something that, as we understand more about the different types of ataxia, which parts of the nerves are affected, we can listen to somebody say, in hot weather, I just don't do as well, and recognize that it's a real physiologic impact that we can then make recommendations how to help. Similarly, some people are very sensitive to cold. If we're cold, circulation to the skin is reduced to conserve central heat. Muscles get stiffer, and a stiffer muscle is going to make it harder to move with good balance. So temperature sensitivities and respecting your body's response to hot temperatures, cold temperatures, I think is important in learning how to manage your ataxic symptoms. Yes, Lori. One more question from the chat.
So what are your thoughts on eye surgery to correct double vision?
Okay, repeat that question if you could.
Sure. What are your thoughts on eye surgery to correct double vision?
If you have fixed double vision, so when you're looking forward, you're seeing 2 instead of 1, you're looking to the left, you're looking to the right, and it's always 2, or looking up or down, and it's always 2 objects, surgery can rebalance the muscles so that the eyes begin to track and you're just seeing 1. If, however, it's only in one direction, while looking forward, there's no double vision, surgery may not be helpful, because you could correct it for looking to the side, but then when the eyes come back to the midline, you may have double vision there because of the surgical process that they did. So I think for fixed double vision, that prism glasses may not be enough to correct. Surgery is easily done and can be very helpful. But with any progressive disorder, after another 5 years or so, that double vision may come back and the surgical intervention may have to be readjusted again. Do we have time for one more question?
Sure. We have another question. Is going to the chiropractor safe?
Okay. Chiropractors are doing more these days besides just the rapid adjustments that they are known for. Many of them are doing more gentle adjustments. They're doing techniques that physical therapists might do. So they have interventions that are known to be safe. I think the big concern was with the rapid adjustments, especially in somebody who has neck arthritis or disc disease in the neck, a rapid adjustment could pinch something. So that, for people with known cervical spine disease, lumbar spine disease, you'd want to avoid rapid adjustments. Now, can a chiropractor do something that will help your, as it were, alignment and improve your core stability? It's possible. And I have patients that once a month will get, updated with their chiropractor to get their alignment back in shape. And these are words that have a lot of different meanings. But I think for an ataxic patient, rapid adjustments in general, if they have any effect, will have a very short temporary effect and could lead to damage. If you have reduced muscle tone, a rapid adjustment could stretch and damage a muscle. Deep tissue massage and rolfing can do the same thing. So if you're starting a new therapy technique, again, discuss it with your physical therapist who knows your body probably better than anybody, and also with your general practitioner. And I think we're at the end of our hour, and there's still a lot of questions haven't been answered.
That is all we have time.
I'm hoping my colleague who's going to be coming on in, I guess, another month can pick up where we've left off. So you're going to keep track of all these questions, right? None of them are going to get lost.
Absolutely, Dr. Perlman.
Very
Thank you
good.
so much for being here with us today. And as Dr. Perlman did mention, in 1 month, we will have another Ask the Expert session with Dr. Zedgewitz. So be sure to look out for notices for that. And I did see a couple of questions in the chat about a recording of today's session. And yes, a recording of today's session will be made available. And we truly appreciate all of you for joining us for today's webinar. Thank you all and stay safe out there.
Good. Bye-bye.
Bye-bye.